Hormone replacement therapy. How long were we told this is really what you need? Estrogen, progesterone replacement. And then after 30 years of it, we say, oh, sorry about that. Causes cancer. That's not good enough. And as a researcher, when I look at the effects today of chemotherapy and irradiation in treating cancer, it really almost breaks your heart. If you've had any close individuals who have gone through these treatments, true, I have to say it's the best we have now. It's all we have now. But we've got to work a lot harder to get something a lot better. Instead of working against the body, we've got to learn to work with it. The chemotherapy and the irradiation literally wipes out the immune system. And these poor individuals are at the mercy of any bacterium or such that comes around. They can't resist the common cold anymore. And we find if you follow them long enough, now that that immune system's been knocked out, they're going to develop a second cancer, a different kind. And my work is based on what are these oxidants in the body, and that term refers to the free radicals of oxygen. What are they doing there? What is their purpose? I bet all of you have heard of free radicals by now. And probably all of you have heard of antioxidants. Antioxidants are now everywhere. Coke has just one antioxidant Coke now. It's in bubble gum. It's in dog food. It's in your bread. It's in your cereals. It's all over. Whether you want it or not, you're getting it. It's kind of like the water supply being polluted, if you will, or contaminated with these pharmaceuticals. These other agents, and I don't want the antioxidants, and I can take days and tell you why, and show you the studies as to why. The antioxidants came on the scene because of an erroneous concept that these free radicals of oxygen caused up to 100 different diseases, pathophysiologies we call them. That was by Dr. Harmon up in Nebraska. And I've met him and talked to him about it. He knows that I think that his theory is so wrong, it's incredible. But it's been around for 50 years, and it got ingrained in the thinking of people in medicine and science, that these free radicals are all bad. Let me tell you this, and as I tell them in some of the lectures that I give to just the doctors and the scientists, if you think oxygen is so bad, you just hold your breath for about 5 minutes and then we'll talk about it. Okay? No one's taken me up on that yet. But that's the kinds of things that can get ingrained in the psyche. The world orthodoxy starts to think that oxygen's bad for you. And one of the leading chemists at UCLA came out with an article in 2003 in Reader's Digest. The very thing we need the most is the thing that's killing us, oxygen. Forrest Gump could figure out that that's wrong. You know, come on. We now know from stroke patients, where they're particularly the blockage type of stroke patients, that within just 3 minutes that the nerve cells in the brain start to undergo deterioration, frequently irreversible. That's how key it is. Our brain is only 2% of our body, but it uses 20% of the oxygen we breathe in. It's an oxygen sponge. It takes it in so rapidly because it needs so much. If it's so bad for you, how can you have an individual live to be a centenarian or 100 years old, and that brain's been using 20% of the oxygen that he's breathed in throughout a lifetime? That makes no sense. And in fact, once we take in what we call ground state oxygen, which is what's in the air, and our bodies start to metabolize that oxygen, it's one of our most significant fuels. And if you want to talk about an essential vitamin or an essential compound for man, the most essential is oxygen. We can do without water for a while, we can do without food for a while, these kinds of things. But oxygen, as we said, abrupt. Very, very abrupt. That's how important it is to us. But once we take it into the body and start to change its electron structure, then these are the very things, these oxygen-free radicals, that kill bacteria. Once our little white cells go out and attack a bacteria and take it into the white cell, how does it kill it? It doesn't have a little gun in there to shoot it with or anything. It oxidizes it. That's how it does it. If we want to clean up the water supply coming out of Hammond or Ponchatoula, we run them through oxidation ponds. We can even break down pesticides and herbicides and organophosphates, all these kind of things, by oxidation. This is how we clean up things on the outside. It's the same way we clean up things on the inside. We can be working in a lab with HIV virus in the lab. We want to clean it up, we get oxidizers. Bleach, peroxide. Clean that up. But yet, scientists and such haven't converted that over. Wait, it works out there. That's what's protecting me all the time in here. These same agents are the one that trigger a cancer cell to kill itself. We would be all eaten up with cancer if we didn't have these things. We're having constant mutagenic events occur in our body. The estimates are 10,000 per cell a day. And we have 75 to 100 trillion cells in which 10,000 of these events are happening every day. We'd all have cancer. You wouldn't know what to do. What keeps that cancer in abeyance? These oxygen-free radicals. I feel so strongly about this that I've tried on a number of occasions because we really need new thinking in these areas. President Nixon came out in '71 and declared war on cancer. We haven't made great strides. But if you listen to some of the publications out there, the American Cancer Society, last year you'd have thought that we'd cured all cancer. No, we didn't. We went from like 569,000 deaths to 3,000 less out of 500,000. That was considered a major step, a major breakthrough. It isn't. I want to see when that 500,000 is wiped out. So I continue to try to get some funds that we can utilize at even Southeastern or elsewhere to get some of this innovative thinking going. Not the same old, same old. As Einstein had said, the definition of stupidity is doing the same thing over and over again and expecting a different result. It's not going to happen. This is why we need this new type of thinking. When it comes to, and I mentioned to Michelle, there was an article just this past week I was very excited about. Now, I have developed ways to generate a thing called singlet oxygen with simple compounds in the body that are in every cell that we have. Inexpensive and effective, and will kill cancer. In 2003, the company that had manufactured the catheter that I had invented put up some money, and we had some studies done at Tufts Medical School in Boston. And in the mice that we had implanted human squamous cell cancer in, we were able to kill 18 to 22% of the cancers outright, first injections. That's better than any other studies that I'd seen anywhere. Now, ran into some problems there, which are typical, though, of academia today. And that problem was that the very guy that we had hired, paid $75,000 to do the experiment, plus added $18,000 more later, wanted to claim the work as his. I had a problem with that. I worked on it for 30 years, and someone wants to come in and usurp it? Don't think so. Not today. Not for this old country boy. At any rate. So we shut those studies down at the time, but the potential of that work is sitting right there. And just this past week, there were studies in rabbits showing that where squamous cell cancer had been implanted, that they insulflated, they blew it in there, ozone and oxygen. They kill 50% of the cancers. They don't know how or why. I think I can tell them how and why. They just sit back and scratch their head. Wow, look at that. Well, that's the thing that was supposed to have been causing the cancers. It isn't causing it. It's there to help cure it. When I look over, and again, this is a list that's been accumulated over some months, probably a year now, of these adverse reactions here. HIV vaccine research hits an impasse. HIV, AIDS, 23 million deaths, 40 million people infected worldwide. What kind of progress have we made with that one? We have spent billions on it. One of the experts, in fact, one of the doctors who received a Nobel Prize, he had isolated reverse transcriptase, a big long name, that is involved with HIV replication. His quote was, "We're at an impasse. We don't know where to go with it now." I can tell him where to go with it. The one thing that we seem to work is a compound called artemisinin. It's an old Chinese medication. It's been around a long time. How does it work? It goes through epoxide formations and it forms these oxygen-free radicals. Any lipid coat on a virus, including HIV, which is oxidized, will in effect kill that virus. We could improve that drastically if we were just able to proceed with the research work. Raise the oxidative capacity of the individuals and do it safely. Oxidation is a part of our everyday existence. We're all sitting here oxidizing right now. Yet you'll see articles come out about these oxygen-free radicals and they say they cause rust. We're rusting to death. No, we're not. And as I say, without these oxygen-free radicals, we would indeed die. There was a Russian scientist I got in touch with about a year ago who had run some studies. They took all of the oxygen-free radicals out of the air in an area where rats were being raised. Just left the ground state oxygen there, but took out these oxygen-free radicals, the superoxide anion, the peroxides, the single dioxins, these things. The rats died. They died within 2 weeks. That tells you something about the need of these things and our total lack of a concept as to what they're doing in the body. Well, of the folks here, if you don't mind, how many of you take vitamins, by the way? Just a show of hands. I used to take them by the handfuls. And what I found out was that particularly the antioxidant vitamins, the A are the precursor to beta-carotene, and the E are probably the most injurious of all. Now, we take them in small doses, so it takes a long time to see the effects. But I've now found studies on over 1 million humans, not the guinea pig, not the wombat, not the tsetse fly, but people. And not only do they not prevent cancer, heart disease, and strokes, it appears that they increase the incidence of cancer, heart disease, and strokes, and overall mortality, deaths. That's the shocker of all. And when you look at the major organizations, the American Heart Association, the American Cancer Society, the American Diabetes Society, the United States Preventative Task Force, none of them recommend taking these things. I can only find one organization that recommends taking them. The American Medical Association recommends taking a multivitamin each day. Even multivitamins in the big studies have shown an increase in prostate cancer. So again, we must be cautious of what we're doing. If you're eating a healthy, nutritious diet, you don't need these things because we don't know what they're doing. Remember, I'm saying oxidation is so critical to our very existence. And here's someone here says, here, take this antioxidant. This can be good for you.